Hello everyone, today we're going to be discussing multiple myeloma. So what is multiple myeloma? Multiple myeloma is a proliferation of malignant plasma cells leading to the release of IgM, IgG and IgA antibodies. Some of the risk factors include African American heritage, age, particularly over 70, as well as having a family history of multiple myeloma. Some of the causes of multiple myeloma can be remembered with the mnemonic CRAB. C for hypercalcemia, so raised calcium in the blood. R for renal failure. A for anemia. And B for bleeding or bone lesions. And I for infections. Multiple myeloma typically presents with bone pain, especially in the skull, the spine, and long bones such as the femur, but in particular back pain, and also symptoms of anemia, so pallor, fatigue, dizziness. Some of the way that we can investigate multiple myeloma is through a full blood count, in which we will see a reduced white cell count, reduced platelets, raised ESR, and raised calcium. We can also take a blood film where the red blood cells will show a rouleau formation, as well as MRI or X-rays, which will show a punched out lytic bone lesions, essentially a soap bubble appearance to the skull, and a pepper pot appearance to the skull. Protein electrophoresis can also show Bonds-Jones proteins upon urinalysis. To manage multiple myeloma, we would first assess whether the patient was eligible for a bone marrow transplant. If so, we would give them an autologous bone marrow transplant and give them long-term therapy and drugs such as thalidomide, methalepin, and prednisolone. We would also treat the underlying symptoms such as the bone pain with analgesia, treat underlying hypercalcemia with hydration and loop diuretics and biphosphonates, and also chemotherapy and radiotherapy. A first-line chemotherapy drug would be bortezomib, which can be combined also with dexamethasone and lenalidomide. We would also manage urate neuropathy with allopurinol. That was a very basic introduction to multiple myeloma. If you have any more questions, please do feel to reach out and in the comments below. Thank you.